Hi everyone, I am Dr. Vimala Chapala, Senior Consultant and Obstetrician, Laparoscopic Surgeon and Infertility Specialist at Cloudnine, Varthur, Bangalore. Before telling about the lifestyle changes or precautions of the high-risk pregnancy, I would like to tell which women are included under high risk. That means multiple pregnancy, which is twins or triplets, low-lying placenta, which we also called as placenta previa, IUGR, which means intrauterine growth retardation, where the baby is not growing as expected in the gestational week, or if there is cervical incompetency, that means the cervix has become short or opened up, or if the woman is having gestational diabetes or gestational hypertension or preeclampsia. In all these cases, we have to advise them to go for regular prenatal checkups, taking good balanced diet which is rich of fruits, whole grains, whole foods and vegetables, eating high protein diets, avoiding lifting heavy weights and bending or sitting on the ground, and asking them to have plenty of sleep, minimum 7 to 8 hours, plenty of fluids, not to go into dehydration, and avoid strenuous work. In case of multiple pregnancies, it is very important to avoid lifting heavy weights and travels. And in IUGR, which is intrauterine growth retardation, it is advised to take plenty of high protein diet so that the weight or the parameters of the baby are well balanced. In case of cervical incompetency, we advise them bed rest to some extent and put them on high doses of progesterones and tell them not to lift heavy weights. And in gestational diabetes and gestational hypertension, along with weight management and taking balanced diet, they should be monitoring the blood pressures and diabetes. They have to monitor their blood sugars at home. Signs of complications which we should look for at home are in multiple pregnancy, if they are having any excess vaginal discharge or foul smelling discharge, or they are having severe pain abdomen, immediately they have to go and meet a doctor. In gestational diabetes, if their sugars are not under control when they are monitoring at home, or if they suddenly put on lot of weight and having extreme fatigue or tiredness, it's a sign that you have to go and meet your doctor. In case of gestational hypertension, if they are putting on weight and edema, which means fluid accumulation is seen in face, body and hands and legs, or if they are having severe epigastric pain, sudden headaches with blurring of vision, or if they are having decreased urinary output, all these are signs that their BB is increasing above normal and they have to meet their doctor immediately. In case of cervical incompetence, if they are experiencing some vaginal discharge or spotting or bleeding, they have to meet the doctor. Or if they experience sudden water gushing out, they have to meet the doctor. In case of low-lying placenta or placenta previa, where the placenta is considered to be low, we advise them prior that if there is any bleeding or spotting or pain abdomen, they should meet us as soon as possible.